WBAE, and thank you, sir, for inviting me. And it's pleasure to present case in front of all dignitaries. My case, I wish to highlight the incidentally detected dilated right heart chamber in a young adult. So the index patient, 9-year-old nursing in charge of a PHC, weighing some 45 kilo, she had congenital heart disease diagnosed in childhood, but she was kept on follow-up. 18 years of age, while she was in training in Medical College, Kolkata, had significant effort intolerance, and she was reassessed in detail in an tertiary level pediatric cardiac center. She was diagnosed, confirmed, and underwent a balloon pulmonary procedure, which resulted in significant improvement of the symptoms. And she was under yearly follow-up with the treating team and was suggested that everything is doing well. So she eventually had fallen in love in first year and eventually got married with a medical college guy. And now they wish to have a baby. The issue, the nursing staff was fearful of pregnancy post cardiac intervention in a congenital heart disease recovery state, and she had still mild effort intolerance. So she thought that they will take surrogacy route for a kid. Now for surrogacy, there are strict laws. It requires a certification that she is unable to conceive. So she was referred by the roommate of the husband, who was in medical college at that time and now our cardiology colleague, for a certification about cardiology status. So when I saw in Medica, she had mild effort intolerance, some anxiety-induced palpitations saturating good lower limb pulse, BP 110/70, H2 normal and short systolic murmur in second space. Her X-ray showed cardiothoracic ratio 0.5, mild parahilar vascular prominence. ECG was sinus rhythm with rightward axis, mild prolongation, PR is 150. And on getting the old document, she had severe, at that time diagnosed valvar pulmonary stenosis with intact interatrial septum, and she underwent balloon dilatation with TISAC 25-4 balloon in 2011. There was 52 gradient pre-procedure, which came down to 16 post-procedure, which is a very good result. So when we saw the valve was well open and the gradient was only 18 millimeter of mercury with mild regurgitation, and the LV function was good with EF 69%. But the issue, as there was mild dilatation of the right ventricle, RV systolic pressure was only 24 plus RA by TR jet, and this TR was mild, the septum appeared intact. So interatrial septum appeared intact and IVC was mildly congested. So it was left arch, no coact and no duct. So I was wondering what we were dealing. There was mild right heart dilatation, which could have been passed off by telling it can be consequences of old right heart obstructive lesion. So I discussed with the nursing staff that I am unable to explain. And she told she is taking Lasix herself sometime and that reduces the symptom. It's an interesting add-on. So the same arch view I was searching then cause, an appearance of left vertical vein to innominate vein. So it was a hemi-anomalous pulmonary venous drainage. Both left-sided pulmonary veins were joining and draining in the innominate vein. You can appreciate the whole of the anatomy. It was a very huge left-sided drainage. So she underwent cardiac catheterization, RA pressure 6, PA pressure 28/7 normal, QPQS 2.5, PVRI was low, and she underwent surgical repair of her veins. The left vertical vein was anastomosed to left atrial appendage in the end to sign fashion, and proximal part was sewed off, PFO was closed. And post-op, good flow documented to the LA appendage. So this is the before and after. I'm just subtle RV dilatation before was not visible. Post RV looked come down in size. So 15-month follow-up, now they don't plan to have baby by surrogacy, rather natural pregnancy, and they are planning. So the essence of the case, detailed history evaluation and chest X-ray ECG, any odd point adds to the clue. This mild RV dilatation could have been passed off. Nothing, a very renowned center saw, and 12 year in consequence every year. So once something is missed, everybody will be reflexly telling, oh, all good, pulmonary valve is good, mild turbulence, nothing is there, good function, mild dilatation, we pass, we just give a pass. But here, somehow, so many clues that mild effort intolerance and taking Lasix, which is symptomatically benefiting. So these small clues led to the diagnosis again and targeted echo. So that's the importance I wish to highlight, sir. Thank you. It was a so difficult diagnosis for me, for this single vein going, two vein going, and these are the most commonly missed ASD and etc. TR, PH that we all think about, but this goes missed. So thank you. It's a really pleasant